Hello.
Hello, everybody. I am back today. Today, we're going to discuss something very sensitive, and I'm so happy to have these two gentlemen. I'm hoping another colleague will join us. As you know, in Africa, there's trouble with telecommunication, but that's okay. That doesn't stop our mission. I'm so excited to be here again. I'm hoping everyone had a lovely weekend. Today, I have two guests. Hopefully, our third one will join us. To my right, I got Dr. Sola. You know Dr. Sola. He was here 2 weeks ago. We were talking about depression, living with depression, and the insights, myths. He helped us eradicate those myths we have as Africans. It was a beautiful conversation. And next to him is Honorable David Nabware. He is actually, before I forget, Dr. Sola is a psychiatrist. He's a British Nigerian psychiatrist. He's doing amazing work in the European space. And of course, he has not forgotten Africa. He does so much work in Africa. He's the CEO of Grey Insights. Check it out. He's very present on social media here on Facebook and also on Instagram. Check out Grey Insights. Follow his work. He's just amazing. He's helping us understand mental illnesses further and also to remove the myths we have in Africa. And next to him is Honorable David Nabuare. He is a community mental health officer in Ghana. And Ghana is so blessed to have this gentleman as their president of their association, the Mental Health Association. Thank you so much, gentlemen, for joining me today. I'm going to start with Dr. Sola here next to me, and you want to give us a little insight about you so that we can know better about you. Other people here are failing you. It would be lovely to have you tell us more about yourself.
Thank you very much. Good afternoon, everyone. Good afternoon, David. It's a pleasure to be on the platform again today. Dr. Naki, thank you for the introduction. I'm Shola Oluoke. I'm a psychiatrist. Originally from Nigeria, but I'm based in the UK. I do a lot of work across both countries, in the UK and Nigeria, and hoping to extend the services to Africa as a whole. I have genuine passion in working within the African space, most importantly, helping increasing the awareness and eradicating the stigma, and generally educating people from my culture and background so that they would know that this is mental disorders are real. They're not death sentences. There's management and treatment available out there, which are affordable. Some are free. Some medications are effective, and people could live a good life even with having one form of mental disorder as well. The main idea is for for people to feel comfortable talking about their difficulties. The way they talk about physical health, they should be able to express themselves and seek help if required for mental disorders. Yeah.
Thank you so much, Dr. Sola. Dr. Sola, you want to move your camera? It's kind of screwed up. I cannot see you well. Thank
Can
you
you
so
see
much.
me? Is it better now?
Yes. Thank you
Okay.
so much. Yes. And next to you, thank you so much for this powerful introduction. Really, we want to change the perception of mental illnesses generally in Africa. I'm grateful we have people like you, and I wish we could have more of Dr. Solas. We are trying, and this platform is to motivate all of us to do what he does because it's such a powerful job, and also he cannot do it alone. Thank you so much, Dr. Sola. Honorable David, do you want to come along and tell us and share what you've been doing?
Thank you very much. I'm David Nabware, a community mental health officer and the national president of Ghana National Association of Community Mental Health Officers. I'm a student at the University of Cape Coast as well, doing health science education have benefited and continue to benefit, because I believe in community mental health. And community mental health actually will ensure that our community is well informed about what they need to know, where they're supposed to seek help, and who should they contact in an event of trouble or having an issue with their mental health. So this is the path some of us have chosen, and we are dedicating all our lives. As Dr. earlier on mentioned, some of us are ready and available 24/7 to partner and collaborate with him and ensure that the people of Africa get a fair share of mental health services wherever they find themselves. Thank you.
Thank you so much, guys. I really appreciate your time here. So I want us to actually delve into our topic. Today, our topic is psychosis. Psychosis, as you all know, it is an umbrella. There's many types of psychotic disorders. So today, actually, this discussion is also quite motivated by what's going on right now in the media. We all know Kanye West. Kanye West is a popular figure out there. People love him. He's such a gifted man. And we have such in Africa. Kanye is African, as we all know. He's of our blood. And here is Kanye struggling with bipolar mood disorder, with psychotic features. He's struggling today, and it's actually affecting his marriage. It has put his marriage into such a jeopardy. We hear that they are going through divorce discussions, which is quite sad. Now, I want you to go back. If you are here watching us, I want you to go back and remember your Kanye West in your community, in your family, because at some point in our lives, we have come across Kanye, and we do every day. At some point, we have laughed at our Kanye West in our communities, in our families. Today, I want you to leave this space with such a compassionate idea, and also ideas on what is Kanye really suffering from. Because we see our Kanye, like I said, we have so many in our communities. Today, though, without wasting our time, I'm going to ask you. Today, guys, I'm not so fortunate, but we know that Africa is a place of families. My daughter is right here, and for some reason, she woke up today early. And, okay, hopefully she'll manage to manage herself. Sorry about that. So without wasting our time, I would like one of you guys to jump and let us know, what is psychosis? Give us an insight. When you say psychosis, what do you mean?
Hello?
Yes, go ahead, Dr. Sola.
Okay, hi. So I would take it from where Honorable David.
Today is. What do you want for this? Okay.
3, 2, 1, go! Oh, yeah!
Okay.
All right.
No! And a boys only slumber party in here. I'm gonna see if I can get in, okay? Hello, anybody here?
Hi.
So sorry, guys.
That's fine.
She's usually sleeping this time. That's why I chose this time. Sorry about that. Dr. Sola, you go ahead.
Yeah, okay, she's settled now. Yeah.
I hope so.
Okay, so I'm going to start from where David said about working in the community. I work in the community as well, and it's important to let people know that services are available in the community, both in the UK and Ghana, everywhere. We're trying to make all these services available so that people could access care. Back to what you're talking about. What is psychosis? Psychosis is one of the type of disorders we have in mental health. The way we have depressive mood disorders, which depression is one of them. We have psychotic disorders. We have eating disorders. We have anxiety disorders. So psychotic disorder is a broad topic that encompasses various type of illness that fall under that spectrum. When someone is experiencing psychosis, the individual tend to experience difficulty in differentiating between what is real and what is not real. And they experience a whole range of symptoms. They could experience things like hallucination, That is where you are hearing voices or seeing things that are not there. They could experience delusions. This could be having a firm, unshakable belief of something that is not really true. They could be suspicious. They could be paranoid. They could be paranoid. They could have a disturbed way of thinking and perception. So it's a whole continuum. But individuals don't have to have all these symptoms to be able to have that diagnosis. And there are various forms of psychotic disorder, of which schizophrenia is one of them. And schizophrenia is a big topic on its own, which I think we're going to narrow down today. There are also issues around drug-induced psychosis, first episode psychosis, schizoaffective disorder. They all fall under different types of psychotic disorder. But with regard to schizophrenia, there's no way we're going to talk about it without doing a bit of history. So this concept of schizophrenia was first talked about by someone called Emil Kraepelin in 1887, and this is a German doctor who taught this, who described it as something called dementia precox. And then this then evolved into the word schizophrenia was actually coined in 1911 by someone called Eugene Bleuler, who is a Swiss doctor. He coined it from two words: schizo, which is split, and then phrenia, which is mind. We should not confuse this with a split personality. He's just trying to explain that the people that experience these symptoms, they have fragmented ways of thinking, basically. So that is where the word came, schizophrenia, in 1911. And then another significant timeline in schizophrenia is 1959, when a guy called Schneiderin, who is the doctor, who identified the first rank symptoms. Bleuler in 1911 as well divided it into two. He divided the positive symptoms and the negative symptoms, which are the positive symptoms are most of what a lot of people do know, which are the common ones, which are the hallucinations, the delusions, and all those thoughts, difficult, abnormal thoughts. We have feeling that people are putting thoughts in your head, or people are reading your mind, all those kind of stuff, thought insertion, thought withdrawal. So those are most of like the positive symptoms. When you talk about the negative symptoms of schizophrenia, these are similar to symptoms of depression, like not depression, but there's lack of motivation, a flat affect, kind of stuff like that. That's when, and then some people also describe some cognitive kind of symptoms. That is probably the symptoms that happens after long periods of the person experiencing repeated relapse and experiences of mental disorder, psychotic illnesses. Then later in life, they can come up with cognitive symptoms. So that is a whole summary of schizophrenia, if I could say that.
You have put it beautifully, and I have noted so much. We're going to go back to you, Dr. Sola. I have questions or comments on what you just said. Honorable Dave, what has been your experience working with psychosis? What are you seeing in your community? Because I like bringing practical cases here. What have you found? What are you doing in your community right now?
Right now, I think it's the campaign on COVID and other mental health issues. I take care of education on general mental health issues, ranging from what we are dealing with to the list that we don't know. We know mental health disorders span across developmental lifespan. Those of the children, those with pregnant women, those with the youth, and those with adults. So I thank Doc so much for his brief intro into what schizophrenia and psychotic conditions are. But just to also highlight, I would like to mention that globally, World Health Organization says that 21 million people are suffering from schizophrenia.
Mm. Today we have a really problem with signal. Telecommunication in Africa is our biggest stressor, you know?
Yeah. I can just continue from where David was saying
It's an
about
issue
in terms
and
of,
affect your
okay.
in as much as it affects the human brain. Let us see what are the things that happens in there in the human brain. We know the brain have nerve fibers of white matter, and that covers the human brain. So in schizophrenic cases or patients, this part of the human brain are somehow affected. So what happens in the gray brain that we say it gets affected? When it's affected, functions such as muscular activity, sensory perception, self-control are affected. That is about the fibers we have in the gray matter. They're moving from there, the prefrontal cortex. And that part of the brain controls cognition, behavior, and personality. So, in as much as this component of the brain have some problems with your cognition, some problems with your behavior, some problems with your personality. So everything from social interaction to our ability to take decisions are gravely affected. And studies have shown that significant dysfunction in prefrontal cortex of people are seen in schizophrenic patients. So moving from there, there is also something we must not underrate when it comes to schizophrenia. That is about the brain chemistry. When I talk about brain chemistry, it's basically between the neurons in the brain via chemicals called the neurotransmitters. So a very prominent neurotransmitter that is seen in researches that have been conducted in schizophrenic patients is the dopamine. And dopamine is seen to influence the way we think, the way we plan, the way we focus, then the way we feel pleasure. So with the levels of dopamine implicated in patients who are suffering from schizophrenia, you are going to have a whole lot of issues that these patients will be showing. So when dopamine is low or high, our patients try to exhibit some signs and symptoms, and this can be seen, or who would like to do more research. When we did
Today our show is interrupted badly.
the dope illusion. Moving forward, in schizophrenia, studies have also shown that the ages that are gravely affected are between the ages of 15 years to 29 years by World Health Organization. So you can see, like, we find most of our patients in the category of the youthful age who are supposed to be productive, but now, because of one thing or the other, we will get there. Thank you. I'll pause here for now.
Thank you so much, Honorable Dave. You know what, Dr. Sola, you mentioned the history of schizophrenia. It basically goes back to the early 1900s. And, you know, it's quite a sad realization because we in our generation, and obviously our forefathers' generation, we had people struggling with schizophrenia. And I'm just kind of, you know, sad for the fact that those people never got the help they needed, you know, because even up to today in Africa, we're struggling to accept mental illnesses. And, you know, the sad part about schizophrenia or psychosis, psychotic disorders, people suffer. a lot of our people, they are not as fortunate as Kanye West. I made an example of Kanye West because he's one of an exception. Kanye West, despite these struggles, he has succeeded in life. Kanye West has Grammys, had a successful career. That's not typical of what we know in our African space, or typically, how many people in your location, in your city, in your village, you saw them homeless with catatonic behaviors, catatonic postures in your city, and literally no one did anything about those people. They suffer today, they suffered in the past, they are homeless, and a lot of times we see them struggling with drugs and end up in jails, don't we? Right? So, how do we educate our Africans to understand? Because now it's even difficult because you just mentioned that when you have psychosis, when you have an episode, you have no insight of reality. So now I would like you to actually emphasize on how do we as a people, as a Black nation, how do we actually get informed about these conditions, because it is disruptive occupationally and also basically affect your family life. We hear about this story now, right now, with Kanye's situation. How do we move forward?
Thank you very much. As with everything, I tend to explain it with the biopsychosocial model about when you talk about the causes, because there are no definite causes. I can't people causes for all these things, but if you use the biopsychosocial model to explain it, it makes it easier for people to understand. To say that the biological factors, their genes, this hereditary, so it could run in family lines and things like that. You know that there are socioeconomic factors. The role of drug, illicit substances, and alcohol could make people predisposed to developing psychotic-like illnesses, and also psychological circumstances, coping skills, ability to deal with pressure, life challenges, stressors, relationship breakups, and people have experienced traumatic, significant life events. Ability to cope with all these things vary from individual to individual, and some people, unfortunately, could develop psychotic-like illnesses. So we need to understand that there are various multifaceted causes to all this, and once we are aware of this, then we can deal with them at different levels. As David rightly said, onset is about late teens to early adulthood, but we do have some people that develop late onset of psychosis as well. It is important that a lot of awareness goes into people identifying what are the triggering factors, what could make individual predisposed to developing this type of illnesses. Don't forget, even postpartum psychosis is there. So it could affect people at various stages along their life journey. And the good thing is that there is help available at different phases. As a consultant that works in the community, I see people across different age groups and different spectrum that develop symptoms like this. And along the early teens, it could be stress, it could be jealousy, it could be drugs. In people of my culture, drugs and illicit substances play a huge role because people know that this, as David rightly said, the neurotransmitters, the chemicals in the brain, these illicit substances, they affect all these chemicals and they alter their levels, and this can result in people becoming slightly suspicious, paranoid, and presenting with disturbed ways of thinking. It is important that we are all aware that these are possibilities. People can be predisposed at any time, and we should try to get the help they need across to them. Also, apart from, there are some modifiable factors, like if someone is taking drugs, we can work with the person to stop. Okay, but some people, it is not drugs. It is about their genetic makeup. It is about the stressful situations they've been through that has predisposed them to developing this. So what I'm trying to say in essence is that if we see someone behaving in this way, the approach is to be non-judgmental. Do not judge the person. Don't add your 1 to 1 to get 4. because your 4 is wrong. You've not walked that person's shoes. You've not experienced what that individual has experienced. You know, when I talk on this kind of shows, I know it's easier for people that watch to try and add one and say, oh, this is this. This is that. So people should stay away from self-diagnosis or self-labeling or labeling people, right? From when they listen to these things. The most important thing is that when you think day-to-day functioning is affected, kindly let the person get help. And don't judge the person, support the person. And if you talk about I know we'll get there, but when we're talking about the recovery model of care, that in supporting people, the role of the family, accepting people and their difficulties and providing necessary support is as important as the main treatment itself. So we all need to educate ourselves, and hopefully there's still a lot of work to be done in the African space. And I really salute David and his team for what they're doing, and hopefully there will be scope for us to collaborate. Moving on from here, I think the first step is to increase the awareness, just to let people be aware that this is possible. The other day, I'm sure you remember that client that came on a true GPAN. And I assessed him, and he was clearly experiencing a psychotic illness, but these resources were just not there for him. You understand? He probably had a bipolar illness with psychotic features. In terms, he had these grandiose beliefs and delusions and all this stuff. So this illness is live and direct. It is with us there in Africa. It is not respecter of any person. It could be anybody, and triggers are readily available. We just need to educate ourselves, and it's stressful. There's a lot of uncertainty around the economy, and people just get to worry and think and overthink things, and they get into that cycle whereby they find it difficult to differentiate between what is real and what is not real again.
Yes. You know what you are mentioning, in Africa, there's so many triggers, and COVID-19, I was quite impressed with the fact that, David, they are busy in their grassroots doing all these campaigns, because at this moment, the world is faced with this pandemic. And this is the time that is unfortunate for people with mental illnesses. They are either actually bypassed or they are missing the care they need. Some of them are not compliant because of this situation. We are asked to be indoors. So I can imagine the triggers are there, like you are saying, they are available there. And unfortunately, the system itself right now is not helping because of what we are faced with. Actually, recently here in Canada, we had a case of a Black child, a 20-year-old, who went to a hospital. He probably had a psychotic episode. He went twice. Unfortunately, the system did not allow him in. I'm not sure if he was coming from another province visiting that city. And in this country, basically, if you're coming with another medical card from another province, there's so much admin work that happens. It looks like that's basically what happened. This guy was denied care, and not even at a healthcare level. The entrance, the admin, it seems like he was not let in. This is a young man who was unfortunate. Twice he went to the same institution. Unfortunately, he basically went right to the lake that was nearby and drowned. Today, yes, this happened just 3 months ago. And apparently he was such a gifted young man, great in sports, and he was such a prominent person in his family and also friends around, but he's no more today. These are the issues we are facing every day in Africa. This is not an unusual, unfortunately, in Africa. This is a day-to-day experience for a lot of families. I would love to hear David. David, do you want to come along and let us know, how are you guys, like in terms of psychosis, and of course it's a umbrella, how are you guys managing these conditions? Are there any campaigns going on in Ghana? Are they consistent? What are you guys doing to make these awarenesses for people to know about these conditions?
He wants you to accept him onto the show. I think it's hard. Okay, yeah.
Thank you. David, I was actually saying I was quite impressed with what you are doing in your community right now. You guys are doing campaigns. And of course, mental illnesses right now are on the surge. And unfortunately, with all the pandemic and also the limitations to like the access to healthcare, I can imagine people with mental illnesses are struggling right now. I'm not sure how you guys are doing in terms of the medications, because people with psychosis, they need their bi-weekly or weekly injections. I'm trying to understand how the system is helping you guys, community workers, to meet these patients halfway. You guys, you mentioned that you are doing campaigns. How are you meeting these people with mental illnesses halfway during this pandemic? Because I'm pretty sure there's a lot of basically either people are relapsing because they were not able to access the care. It's been going on now for 4 months, almost 6 months we've been faced with this. How is your government? I'm sorry, I'm going to ask a political question, but how are your governments meeting you guys halfway to help these clients? David? We seem to have trouble with David's connection. Hey, Dr. Sola.
His connection is now
really poor.
well.
Yes, you had me with what I was just talking about.
Yes. So during this period, I can't fault the UK government. They've done very well, in my opinion, during this time in terms of providing support. Although at times because nobody knew what was coming when all these COVID things start. So probably some of the things have been catch up, but at least they're trying their best. And also with growing sites, and in Nigeria as well, a lot of corporate organizations have been doing a lot of work. We've been doing a lot of webinars during this COVID period, doing a lot of presentations. And it's really been very, very helpful to the staff just to be able to be aware of how to cope with their emotional and mental well-being, because there's been a lot of changes to the way we're living our life, routine, working from home, homeschooling, and all this. This have put a lot of people under undue strain. Even the fact that they're having to lock down in the same house with partners, kids, and all 24/7. It's a lot. It's very, very difficult for some people. And when I did a few of these presentations, and I approached it from the fact that some people already have existing mental disorders, while some people don't have. The people that with already existing mental disorder probably struggled a bit more to cope, because their outlet was either going for walks and enjoying the nature and doing things, and they couldn't do that. Despite the fact that they have difficulty, they can't now even utilize their coping strategy. So it was a lot more difficult for some, while some were used to staying indoors and they were just not into anything. It suited those ones. So it was a mixture of a lot of things. I'm just going to go back again to the help available for psychosis. And we're talking about the psychotic disorders. There are I don't want people thinking anybody that is experiencing that automatically has schizophrenia. No, that's not correct. There are concepts called could have the acute and transient psychotic episode, or you can also have the first episode psychosis, which the acute and transient, that is possibly someone experiencing that, all those symptoms we've talked about, but it's not lasting for long, or it's just due to a stressful period or life event, and then they are able to go through that phase, and then they move on, and that is the end of it. So it's that's not schizophrenia. That's just an acute and transient psychotic episode. But it might recall later when they are exposed to stressful situation again, but that doesn't make them schizophrenic. Also, first episode psychosis, when someone develops some of these psychotic features, and does not really fulfill the criteria to have diagnosis of schizophrenia, and it is the first time they are presenting like this, you could easily call it a first episode psychosis. In the UK, there's a clear pathway for people who present with symptoms like that. You refer them to the early intervention or the first episode psychotic pathway, where they have a very, very robust and good level of care for at least up to a period of 3 years, which include a lot of psychological support, psychoeducation, medication, and even therapy, family therapy, to let the family understand. Because as I said about the recovery care model, it is very, very important that people have the caregivers and family members are supported as well, and they are aware of how to manage situations at home. That will give the patient a very good chance of a better chance of recovery. So the pathway is clear here, but in my beloved Nigeria, I don't think we have. I don't think we have
general,
that.
in Africa, yeah, in general, Sola, because right now in Africa, we both know that these people are mostly on the streets. You know, even their families are not accepting. I wish we had such a model, and with such experience you have, and I mean, even here in Canada, that's basically typical what is happening. I wish it's something we as young mental health professionals could probably bring that to our African space. We need support for these people because I've seen it working in South Africa. I remember during December time or Easter time, people, they want to be busy with their lives. The families would basically dump these people at the hospital, and the hospitals are overcapacitated. We don't have beds. So like, I like that model of also that psychological support for families to understand and accept their people, because we still lack there in Africa. And it doesn't matter if it's a literate family. A lot of African families do not accept people with mental illnesses, more especially with psychosis. We see them out in the streets. We see them living with neighbors. We see them like, you know, they are homeless, a lot of them, you know. So I wish we could have systems to improve this. And of course, our governments, they would really appreciate, but of course, we can't wait from the governments. We need to do it like you guys are doing it privately.
Yeah, that it was important what you said, and all this not that non-acceptance from family and all is due to the myths that surrounds psychotic illnesses. There are a lot of myths there. A lot of people think, oh, they are aggressive, they are they have some people explain it with demonic.
Yes.
They are being possessed by spirits, and as much as I don't, that's not my area of specialist in deciphering what is demonic or not. It is if we all take that non-judgmental approach, don't judge people before. At least give them a chance, because I'm sure people present those guys on the street and due to psychotic illness, if they were in their right state frame of mind, they wouldn't be doing that. They wouldn't do that. And I know some people with psychotic disorders could be aggressive, but not. You shouldn't generalize to say everybody presenting with some form of psychotic illness will be physically or verbally aggressive. So it is important, very important, that you don't just use one umbrella to cover everybody. What we need to do is to continually educate ourselves. I really want to hear from David how they are doing the awareness. Is it government supported or individuals like him that are just propelling doing that work?
David, did you hear Dr. Sola? It looks like he's frozen, Dr. Sola. David, are you able to hear Dr. Sola? For some reason.
Yeah, I've heard him.
Okay, go ahead.
Can you hear me?
Yeah, we can hear you.
Yeah, so thank you very much. I think doctor was very emphatic when it came to the signs that patient will show, and that was the psychotic phenomena, which are hallucinations and delusions, which we know are very key when it comes to persons with what we're talking about. So moving into the question he asked me about how we're doing our campaigns and advocacy and the likes in terms of creation of awareness. Yes, there are more hands from the government side than what happens at the private sector in terms of NGO and other organizations. So the government has a policy that it starts.
We have a terrible connection today. Yeah, I think we're gonna rethink our platform and see what other options we have. You know, while we are managing
in 2000 alarming. Yeah, I hope you can hear me.
No, we missed that. Your connection
Yeah,
is
what
really
I'm saying is that what the government did was to train more people as
good.
community mental health officers, and a program was mounted in one of the colleges, the College of Health, Kintampo, to train us to be able to go out there, do more of the community work, because it is believed when more advocacy, more campaigns and educations are provided, a lot can be done in that area in terms of identifying the cases early, be able to link them up with the prescribers, the psychiatrists and the psychologists who be able to care for them, and also be able to provide timely intervention when they need be. So the government has done so well, and my professional category and myself in the country, we are over 800 as I talk now, that has spread across the country to serve. And we find ourselves in hard to reach areas, sub-districts, and so you can see like
Oh man, we missed that important part he's mentioning, but it looks like their government
yeah,
is
what I'm saying is that a lot of the mental health community mental health officers are trained from that college and are posted to any part of the country to serve in terms of providing primary mental health services to our people at large. So wherever you have a chief compound, a sub-district, even not a chief compound, a sub-district, there is a mental health professional who is a community mental health officer within that catchment that will provide education on mental health issues to the people over there. So thereby there is that kind of provision of services to the doorstep of
That network is terrible.
our
so much. Yes.
people. The services mental health to this
Okay.
Yeah, no, it's terrible. Do you
Can you unmute me? Yeah, can you hear me now? So what I'm hello.
Yes, we can hear you.
Yeah, so what I'm saying is that the government has done so well to train us to be able to provide services at the primary setting. Where you find primary health provider, there is a mental health person there to provide service, not far from probably chief's compound and health centers. So this is an initiative of the Ghana government through the Ministry of Health, Ghana Health Service, and Mental Health Authority. But this program was introduced by some UK partners, and now we are almost hitting 1,000 professional capacity, which I think we are
That's
even
amazing.
looking at getting to every community. We must get a mental health officer. So
Yeah.
now, yeah, very, 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 very laudable. And mental health services in Ghana are getting on its toes, because if we are saying that probably doc is at the consulting room and I need to move in there with the patient, what about if the patient need probably some kind of emergency mental health services of someone who has that knowledge? How do I even get there? When do I get there? Who sends me there? If I need the services.
Okay,
So this
I know it's
these
so
people
tough.
find provide, our patients will get them. But our problem now, you spoke about the problems we face. We know the government has done well, but we still have problems with medication. We have problem when it comes to medication. We have problem when it comes to some of the clients. You know, anyone who is almost, I can say a lot of them with mental illness and poverty are closely related. And schizophrenic patients are not excluded. So you find these patients in most circumstances not able to even embark on probably caring for themselves for their basic needs. So I think the government in its own way has also done something that I think most of our people listening to me in other parts of the African continent can replicate. The disability fund, most of the districts are having it. So mental illness is also part of the disability. So if you find yourself in a district or a municipality, a metropolis, this fund is there for you to access for your clients. And the municipal chief executives, the politicians are ready to assist. But that is when the funds are available. Then you present probably your area of needs or what you need, and the government will assist. But we are not getting the support timely. We know as for funds from central government, they take time before they come. But I think our government is doing something to address the situation. But we still need more in terms of clients being able to understand that mental illness at times they shouldn't call it all of that is probably evil or spiritual causes, but the massive professional help of which doc spoke about. I think all that social approaches at times you cannot ascertain, but these are some of the risk factors. These are some of the possible causes. So our people must understand that we must seek intervention early. Family must support. And in fact, I want to reiterate here that the most fortunate thing about mental illness is that your family is the first point to identify that you have a problem. So if your family member, your close relation, identifies that you have a problem, then I think our problem is somehow reduced. So at times the family must not close their eyes on what an individual or a family member does. Your husband, your wife, your brother, or whoever, you must keep an eye on the person, looking at the way he does his things, so that you be able to identify your behavior. I think something is going on wrong. So what do we need to do? Some of them, the patients will always deny that I don't have a problem. I don't think I'm sick. Even you talking to me, I am the richest person in the world. Most of the schizophrenic patients, they talk like that. Do you even know that I am the president of the country? Can you joke with me? I am the IGP. I can even arrest you right now. So people find all these things funny. And some, in fact, you see them exhibiting some kind of, I will not say they are funny, but that is what goes in the brain. You know, the brain is an electrical something. When it discharges, the functions are emanated.
Yes, yes. You know what, you guys, you have mentioned a lot of things here, and the internet is just messing up.
They keep coming as they come, as they are exhibited. So what do we need to do? The family is that we want to, one point in time, have a conference whereby we will assess our output to our patients, and that will serve as a baseline to know whether we are actually doing well or not in all areas. It does not mean your location or wherever you find yourself, but any part of the country you are as a Ghanaian or an African on the continent, you must get mental health services. That is all that we are trying to do. And I know the government is training more of us to get to the community. When someone is having the brief psychotic symptoms or the episode, I've taught how to probably rapid tranquilize that patient and be able to move that patient to a psychiatrist, a psychologist through our referral system. And I think this is what the Ghana government, through the Mental Health Authority, Ghana Health Service, and Ministry of Health are doing, of which I always say that wherever I find myself, I will thank the people of Ghana and the government that, in fact, they are doing well in this area. But the logistic constraint can never be underrated. It is an issue I think the whole continent or most countries are facing. We still have some logistics constraints. I know some medications come from time to time, but still, our patient, when it gets to time, they need to pay out of the pocket. And then we know these patients, in one way or the other, most of them are rendered vegetable, if I may mention that word, because they cannot do anything for themselves. So if that person was the breadwinner of the family.
Yes.
You ask yourself, who buys
Yes.
the medications for that patient?
Yes. Thank you so much, Dave, for this input. You know, you mentioning
and the other burden coming in here. So it's an issue. I know that the government should one demand.
Dave, I see we're gonna be wrapping up right now. I just wanted to say something about what you said. Thank you so much for your input. And I'm gonna just kind of mute you guys because there's a sound. Yes, you know, you guys mentioned a lot of things, and I wish we had a really good telecommunications here. Without forgetting this part, I would like people here to understand that psychotic disorders, including schizophrenia, which is our main topic today, doesn't choose race, class, social class. We have actually few doctors suffering from schizophrenia, and also professionals. I've seen people with bipolar mood disorders, with psychotic features doing really well in their careers, but when they are ill, things just turn around, their lives are turned upside down. So this is a condition, psychotic disorders, it's something that we all need to understand and not judge, because it could hit you in your down moment. Like Dr. Sola mentioned here, Dave, that triggers could be stress. Right now, we are in a pandemic where everyone's cortisol levels, adrenaline is pumping up. We are all stressed right now. It could be a trigger. You know what I mean? So we are all saved by grace at this moment, because we don't know if we have some genetic predisposition. You understand? These are the moments that we probably see more people suffering with mental illnesses because of this extreme stress no one was prepared for. You know, and before we close, because we're going to be closing here, I would like you guys to talk about medication, because I know that people with psychotic disorders, they tend to experience quite serious side effects. And I know that there's more medications, they are advancing, side effects are becoming less and less, which I'm very grateful, because I remember training 15 years ago, we used to see people struggling with side effects. And then now there was another problem of side effects on top of the issues they were struggling with, the illness itself. And then that's when we saw high rate of non-compliance. Do you guys, Dr. Sola, you want to talk about medication options and also how do people take care of these side effects? Thank you.
All right. Thank you very much. So medication, big part of the management of psychotic disorders. Typically, the antipsychotics are the treatment of choice, and typical, we have two broad classes, typical antipsychotic and atypical antipsychotic. The typical ones are probably the old generation ones, the older ones, and they have side effects which typically disorders of movement, akathisia. They make people a bit rigid, a bit, some people drew saliva and stuff like that. But there are newer antipsychotic medication, the atypical ones, which are fewer side effects. I'm not going to say no side effect, but I would describe it as fewer and more manageable side effects. Even with the typical one, the side effects are manageable. It depends on how the individual is presenting. Then you try to make a profile and what are the predominant issues before making a choice. As I said last week, the other time we spoke, that the choice of medication is always meant to be a conversation between the doctor and the patient, so that you can, the patient will know what they're getting into. You discuss side effects and benefits. And also, if you have it at the back of your mind that repeated episode of psychosis will continually have significant impact on the brain. So let's say, for example, if first episode affects 2%, then next episode will affect another 2%, and cumulative effect, then that's when you end up with long-term cognitive issues. And also, this also impacts on the economy as a whole, as David rightly said, that the individual might not be able to work, provide the family. So it's benefits, and you weigh up the pros and cons, and eventually, antipsychotic, there are very, very good ones that if weight is the problem, you can get ones like aripiprazole that are not as that don't give weight that much. They are different. It depends basically. on looking at what are the issue with the patient. And then also there are long-acting injectables for people that compliance are problems for, that forget to take medication, because poor compliance is one of the commonest causes of relapse in of mental disorder. So long-acting injectables are there weekly, 2 weekly, monthly, depending, and they are able to stay in a steady state on the blood for the duration and prevent relapse of mental disorder. So there are very, very good, safe options out there. But still, I don't want people to think the medication is the only way. It's not the only one. It's a joint one with psychological and psychoeducation, so that people can understand what the triggers are, what the stressors are, understand the early warning signs. It is very, very key. Early warning signs, triggers, stressors, and a good support family structure and friends as well, because some people don't have family, so far nobody will know. They will rely on their friends or even colleagues to help them. That is why continuous awareness and education is extremely important.
Right. You know what? With that support, we mentioned in the beginning that the beginning of psychosis, a lot of times, usually like the schizophrenia specifically, is that early time, 15 years. In our countries, I have never, in my experience, when I practiced in South Africa, seen mental illnesses discussed at a school level. You know, because this is the time where children are more vulnerable, they are doing drugs. I want to know actually from David here, if you can hear me. Dave, can you comment about campaigns done in the school level? Because that's when these are the young and vulnerable, or this is the young vulnerable population where this we see the risks more. Like, I mean, we talked about the drugs, the alcohol. What have you guys done at a school level? Dave, you want to make a comment on that?
School mental health activities are part of our core responsibilities as mental health officers. So what me, for instance, and other colleagues do is that we try to form a mental health promotion clubs. And these clubs serve as even the link between us and the community. When they close from school, they try to tell the community who doesn't have the opportunity what we teach them in terms of mental health. And I'm even happy to even share that even my first mental health club, they wrote an exam before the lockdown came, and they performed well. There were 59 pupils I engaged with 29 boys and I think 30 girls. Yeah, and the performance was, they really understood what I took them through, what the brain is, brain functions, what they must know, what, and a lot. Now when the lockdown came, they even helped me to do some of the education in the community.
Oh.
Yeah, maintaining social distancing. So this is what we can do. The young ones can actually help us even propagate this information there more than the adults who are busy but will have the problem and will not even know until someone prompt them. So we must engage even young ones, 5 years, 6, 7. You should enter the schools, the churches.
Hello, Mr. Sam.
Hello.
It's also another also helping. We link up with the pastors, and the pastors ensure that they put us on their programs. We educate the congregation on mental health and mental illnesses. So in this way, we are able to get into the community with ease and be able to imbibe into them good mental health messages. And whenever they have the cases they call on us. Oh, professional, we have had this case. We think it is your area. Can you come and help? When we come and there is the need, then we refer to a more senior person. So this is how the link must be.
Wow.
The faith-based healers will go there to do the education, link up with them, and in fact, you get an impact when you collaborate with faith-based healers, when you collaborate with the schools and everyone, the community stakeholders. They are going to be calling you more often. Then radio talks are also being done for mental health. People will be calling you from time to time. What you spoke on, I think we have this. Can you come around and educate our community? We enter the community too. That is where some of us even have to spend most of our hours. We need not to be at the clinic at times. That is what we're trained in. More at the community,
Yes.
we get to know the cases. Then
Mr. Dave, I wish I could let you go on and on. We are joined again by Sam.
if
Sam is also one of, sorry, Dave, I'm going to wrap up now. I wish we had more time.
we can
I wish we had more time. I'm gonna just let Sam here speak for just a few seconds. Sam, I know you struggled.
now come to the
Thank you so much for trying. I would like you to just have a word in your community. It looks like you guys in Ghana, you're doing an amazing work in terms of things that are on the ground. I'm quite impressed with also the involvement of your government. Do you have a word? Because we are wrapping up our time. We're actually over. We had struggled with telecommunications here. Do you have a word on what you can advise people out there, people, your brothers and sisters, in terms of awareness on psychosis or schizophrenia? Do you have something to say there? Sam?
Hello.
Yes. Do you
Yeah.
have some word for your brothers and sisters out there about schizophrenia or psychosis awareness? What can you advise young people out there watching us?
Yeah. Thank you very much for having me. I must apologize. I struggled a bit to get on, but I would say that it's not a very pleasant place to be. It's not a good experience to go through, and we need to give all the support that we can. Just like we'll give every other person that is not going through any form of condition like that in the workplace, in the church, in schools, and everywhere. It is just like you are in the community with everybody, and you are just standing there with the person, and you cannot see anything, you cannot hear anything, but then you realize that the person is reportedly telling you that he or she is seeing something that you cannot see or feel. But the thing in the person's own world is a real crisis he is going through, but you cannot feel it, you cannot see it. And so it becomes a very, very humiliating thing to do. Um, and we just need to give them all the support. I think my people might have already touched on a lot, and time is out. But we just need to understand that psychosis or schizophrenia is not so much of a comfortable place to be.
Yes.
We just need to give them the support, the support, the support. We need to love them. Most of people I have had experiences that have had enough support from family, from their professionals, from their churches, from their schools, enough love, do well even without medication. They are able to really, really, really do well. And some are even able to overcome it and even get out of medication within a short time. So I feel that we as Africa must rise up to a new knowledge, and we must have a new understanding and a new language when it comes to mental health. And then when it comes to schizophrenia, when it comes to psychosis, where the person will not live in abject tension all the time, but the person will once a while come out of it, be normal, and then the next stage is also experiencing something way out of reality. And then I think that support is the best that we can give them in terms of their medication, in terms of love, in terms of anything that they will require us, so that they can be more stable, so that they can be more effective, so they can come back to normality and then live life, because that is all that we all need to do. we just make life meaningful for each other. And then that is where we need to get to, especially as Africa.
Yes. You know what? I wish I could stay longer with you guys. It was a beautiful conversation. And I think we actually need to do a part 2 on this because we had some interruption. Unfortunately, Honorable David wanted to say a lot of things. We could not really hear a lot of stuff he said. But I think we can actually model what Ghana is doing. I think, Dr. Sola, you'll agree with me that honestly, Ghana is ahead. You know, this is just beautiful to realize that in Africa they have model things that are happening in Europe. It's such a beautiful place or an experience to hear about. And Sam also just wrapped up that we all need to support our people. We need to love them with unconditional love, support them. And honestly, when we have that as families, these people will not be abandoned in jail. These people will be avoided going to alcoholism, drug abuse, you know, jails and being homeless. If we as family members or as communities understood and appreciated them. And I actually like the involvement of churches because last time we talked about mental illnesses, we mentioned the role of church. So I'm quite impressed with the fact that you guys are in that space. I have hope for Africa. Guys, I want to thank you so much for being here, and I'm hoping to bring you again. Thank you.
Thank you very much.
Thank you. Thank you very much.
Thank you.